So this next session is called Track-a-holism. Is this a disorder worth having? We started thinking this year about habits, and the word quantified self was a hot topic last year. And I was thinking to myself, well, the quantified selfers are the people that are so obsessed already and they're so healthy that what about the other people out there that need that actually need these habits? And so this session came to birth. So I want to welcome Leslie Ziegler, who's not only a good friend, but she's an incredible entrepreneur, designer, health advocate. And her motto, do or do not, there is no try. Have a great session.
I figure you can't go wrong with Yoda, right? So thank you for getting your lunch. We would hate to be the thing standing between you and food. But welcome to Track-a-holism, so I'll be the first one to say it. I am Leslie, and I am a track-a-holic. I actually spent an entire year of my life while I was part of the founding team at Bionic Health, which is a startup accelerator in San Francisco. And I spent a full year of my life actually tracking absolutely everything that I was doing. So, obviously a lot of the stuff that these guys are working on is really appealing to me, but went through that process of, what does all this data mean? How do I deal with all of these different devices? What do I do about this? And then really, how does this stuff start becoming useful? I think quantified self's a pretty buzzy thing right now. So these guys are going to shed some light on, what's going on with manufacturing and the device side. How do we actually start making sense of what those devices are and what their uses are? And then also we have a very interesting new product that I will let Rob explain a bit better, but maybe we can just go start with Mr. Kraft. When we were standing outside, we were talking about extreme cases, right? So these extreme cases of track-a-holism. Can you share the one that you were talking about?
Well, as a physician, I'm a bit of a track-a-holic. I'm wearing 6 or 7 devices plus a patch.
And those are just the ones you can see.
That's right. I've got the other patches right here. One extreme case, we think about quantified self or track-a-holism around often simply wearable devices and vital sign data. But I met one gentleman at a QS meetup who was recording all his thoughts for 10 years, and he had a database of all his thoughts. We could look up what he was thinking, when and where, and that's a bit of a scary thing. But as we get more connected to our devices and our Google Glass and beyond, we'll have access, I think, to more of our prior states. So track-a-holism, I think, tracking will go well beyond our sort of usual quantified self state.
Cool. Rob, do you want to talk for a second about, maybe we can just give a little background for everyone. Do you want to talk a little bit about Soylent?
Absolutely. So my name is Rob, and Soylent I would describe as a form of quantified food. I am a quantified self enthusiast / guinea pig. I like to try things, and I thought it was perhaps high time that we started looking very closely and breaking down our food and trying to quantify it better and have a better visibility of exactly what we're eating rather than just basing things on tradition and bringing food into the loop on health and healthcare. I think would be very, very advantageous in the long run. So in order to quantify food as it is so ingrained into our bodies, it behooves us to quantify our health as much as possible as well. So I don't wear many devices, but I do sometimes use the Dexcom sensor. I'm really excited to see the CEO, Terry, here, and get my blood work done regularly. I even have a Siemens Dimension Expand chemistry analyzer in my basement, so I can measure my own blood. It was getting too expensive to send stuff up to the lab all the time, but I believe that an ounce of prevention is worth a pound of treatment. And that in order to improve, one must first measure. And so by having better visibility of our health and our food, I think that we could do a lot for preventative care and overall health and wellness.
And what's really interesting about Soylent, so I don't know how many people in the room have tried to track food. Can I get anyone? Yeah. Okay, it's terrible. It is the worst because there is no easy way to do it. It's all kind of, I think it has this many calories, whatever. What I think is really interesting about Soylent is it's actually kind of the opposite of tracking. It takes that whole business of trying to keep track of all the calories and all the stuff completely out of it so you can focus on other things.
One interesting thing that's going to happen with that, one of the other tracking elements now is the microbiome. So the fact that you can now track your GI tract bugs throughout. There's a new company called Ubiome doing that. That's going to help inform better nutrition, as well as
Absolutely.
prevention of chronic inflammatory bowel disease, elements like even obesity. So.
Yeah, I'm still waiting to get my sequence back from you.
You and me both, buddy.
Yeah, very, very
Yeah,
excited.
get Jessica on that. So, in the vein of devices, so we've got our two device makers here on the other end. Would love for you both just to talk a little bit about form factor and how you both look at that uniquely. You want to start, Jen?
Sure, yeah. So I too am a track-a-holic. I never leave the house without it. In fact, I sleep with these. So this is a tracker that has an ECG. This is a tracker that has a optical heart rate monitor. I guess getting to your point about the form factor, I think one of the things that we think is really important is that you should be able to visualize what your day has been right away. So you don't really have to wait for you to sync the data to a phone to be able to visualize it. So we actually have on both of these devices, you can actually mode in and you can actually see the actigraphy and the sleep pattern for the entire day, and kind of the form factor is kind of dictated by that requirement.
That's great. Yeah, and I'm Kristian. I work for Sony Mobile, and I'm here because actually at CES we're launching our new product, the Sony Smart Band. So that's how we tie into mobile health. And also we launched a product, a smartphone as well, called the C1S, which features N+, which helps us tie into basically all kind of sports activity trackers that's on the market today. So that's how we fit into this mobile health space.
And I think we actually have a video of that. Do you want
Yes.
to show off a little?
We have a short video clip explaining the new Sony Band we're launching. So, please.
Any plan to bring it to Apple so us Apple fangirls can
Yeah.
try it?
So our phones are Android-based, so we support all Android 4.3 devices, and we know iOS is huge, especially in the States. So perhaps going forward, this is something we can consider. Yeah.
So along the lines of this form factor thing, so everyone who's raising their arms at this point, it's all wristbands, right? And this was the thing at CES last year too, right? Fitbit finally launched a wristband. Everyone's got a wristband. I would love to hear just feel free to chime in. Do we think wristbands are the right form factor? I mean, they're kind of wonky and clunky. It's hard when you're on your laptop and you're typing. It's a little kludgy if you're going on a run. So maybe.
Yeah, we actually looked at the concept of dynamic wearability, and what that concept is that there are certain parts on the body that's more amenable to a tracking device. Wrist is actually one of them. There's an area around the neck here, around the waist, around the ankle, the top of the foot. But I think the wrist is actually, I think, an ideal kind of acceptable position because wristwatches has been around for a very long time and it's kind of fashionably acceptable. And the other kind of big advantage is that you should be able to kind of glance at it and be able to take in the information. But we did actually early on, working with NASA, looked at devices that go on the upper arm as well as around the head. But this is, I think for consumer application, this seems to be the most ideal position.
You've got some thoughts.
So I think one element, so my academic hat is I chair the medicine track at a program called Singularity University and a program called Future Med, now called Exponential Medicine. And I think a lot of this quantified self and these technologies will start to disappear as we move into this Internet of Things. And so this is still sort of, in the QS 1.0 era, but as we get the MC10 type patches, things embedded in our clothes and our cars, the connects in our homes that start to measure us, this will be way beyond wearable. And the Google Now of quantified health will start to emerge. So imagine having a GPS for your healthcare. It might show up in your Google Glass or elsewhere, notifications from all these elements, because I think it's no one device that's going to be enough for track-a-holics or actually for really prevention, diagnosis, and therapy. It's going to be the integration. And my favorite example is, like your car has 300 sensors. You don't care about any of them. You don't even want to glance at them. You want to know when your own check engine light goes on. And that means it's the layering of the sensors, the big data, the analytics, the sort of the IBM Watson that can learn about you. I like to call it predictalytics. And I think when that all melds, the form factor will sort of disappear.
There may also be something to be said for putting aesthetics and fashion first. Someone may want to signal to their friends and their colleagues that they are the type of person that likes to track and is very serious about their health. And but people want a high degree of individualization for this sort of thing. I mean, you look on the trade show, there's only a couple colors of iPhones, but there's thousands of these different cases. So people love to express themselves with their devices these days, and it seems like fashion is really merging with technology. And so getting the hardware down first, and then stepping back and looking at the use case, and people have been wearing these technologies, these watches for a long time, and it seems like it's not really that much about telling time. It's an accessory. So maybe taking a more traditional, maybe even analog watch face sort of form factor with the tracking may be something that could get it into a new market.
And I'm thinking about around the same lines, actually. I mean, sometimes color is not enough to be able to switch colors, but plastic, rubber might not be for everybody. Somebody switch it up, want to have some kind of leather bracelet or textile or fabric bracelet. So I think to not look techie is very important to many people. To not be able to, you don't have to explain yourself, like what's that on your wrist or what are you wearing right now. So it has to blend with your style.
Yeah.
I think that's important.
Yeah, I mean, if you look at companies like MC10, who's always been a favorite of mine and I'm actually working with now, what's so interesting is it's just this patch and it flexes with your body. It's built for the human body, not against the human body. But it brings me to this other point, which is, okay, we've got wristbands, we've got external patches that do things, that can sense things, different analytes and whatnot. Who on the panel would you allow someone to implant something? How do we feel about implantables? Because if we're talking about disorders, yeah. I'll volunteer, like implant whatever you want, as long as I never have to track another calorie, another food, like I'm in.
I think that would be the next step in terms of having passive tracking and abstraction and just the amount of different parameters and the precision of that. It seems to be that there's only so far that a Surface device can get you, and that having something maybe not completely inside, but at least some component of which interacted with past the skin may be mandatory.
And actually, the new generations of medical devices, planted defibrillators, ASCDs, neural pacemakers, those that are in a body and track things, they can often communicate with IP addresses and apps. You heard about Dick Cheney turning off his connectivity so he couldn't be hacked. Might have been a good thing if he had been. So that even raises the issue of, what happens when someone hacks your insulin pump or your pacemaker, and then who even owns the data? I think Hugo's here, who had trouble getting the data from his own implantable devices. And one thing we haven't mentioned here yet is we're still all wearing individual information. You can share things with Jawbone and others in the community, but when this will get more powerful, I think, in the broader context, is this idea of it's been mentioned here, participatory healthcare. And just like Google Maps or Waze allows you to share your location and your speed, you give up a little privacy, you and then are getting some information back about what's the right route to school or where's the traffic jam or the police hanging out. And I think there's an element to blend track-a-holism with big data and sharing, kind of the idea of being a data donor will be a part of that, whether it's implanted or wearable.
Yeah, I think one downside about implantables is that I personally like to try out new things every couple of months, and so it may be painful to do.
It'll pop right out. Come on.
Yeah, the needles are getting very small.
Yeah. I could have several, I guess, at the same time.
But also, like we spoke just before the session, is perhaps a pill could be interesting as well.
That's true.
That's very familiar to us to take a medicine pill, and it's not as scary as implanting something, and we know what's going to happen with that pill eventually. So
yeah, but again, the gut is a very chaotic environment, and getting the blood, I think, would have the most of the useful metrics in order to track. Hormones, different, perhaps not even just for tracking, but in healthcare, having the patient take a drug and having visibility of the concentration in the bloodstream rather than just say, oh, you're a big guy, take 60 milligrams. Seeing exactly the dose that's in the bloodstream, I think would be very valuable for treatment.
So we have two physicians on the panel, and I'm curious how you see the whole movement of quantified self actually entering into medicine in a meaningful way. I think we're still kind of, the two are still at odds, right? Like most of these devices are not reimbursable. They're not seen as medical devices. They're not regulated that way. I don't think counting the number of steps that you have should be regulated. But do you have any thoughts as to how medicine starts playing with quantified self?
I think it's sort of the opportunity is to move from quantified self to quantified health. And I talked to a lot of physicians and others who are still sort of clueless about the fact that there's a connected blood pressure cuff that you can buy in an Apple store and that you could prescribe that to your patients as a tool. So I think part of the meme of this meeting and as we're seeing the sea change is that as a physician, I can prescribe you an app and device. Hopefully that data flows back. I say, Leslie, I'm prescribing you exercise. Let's see how you do. Even if I never look at that data, the Hawthorne effect might mean you stay more on top of what you're doing. And the incentives are starting to be aligned by Audax and others, so the progressive car insurance model. And as physicians are getting more reimbursed based on value and outcome, I'll start being incentivized to prescribe those sorts of technologies. It may be checking your microbiome and your 23andMe data and others to integrate that in as part of your care plan.
Any thoughts?
Do you think doctors are doing enough to encourage the tracking and prevention rather than the treatment?
Well, I mean, the sea change opportunity is to move to healthcare, not sick care, and that's
Right.
where a lot of these things are gonna meld. Maybe I'll just mention briefly something that this will be a sort of a special announcement here. I get asked all the time which one of these devices is right for me, or as a physician, what to prescribe. So actually, you can get an early peek. I'll just need the slide deck up. Given the explosion of digital health devices and this new realm of moving to potentially quantified health, and the concept that consumers are now getting on the bandwagon, as well as potentially clinicians, and there's the idea of the smartphone physical that Shiv has started and others. There's new tools for everybody to start using. The trick is how to make sense of those. And if you go to down on the floor here at CES, you're overwhelmed. Even in an Apple store now, there are 30 plus connected health technologies. So the challenge is to sort those out. So based on that issue, just our soft announcing here, we'll officially launch in a week or two, Bionic Health, which is sort of the first marketplace and community for all of digital health, for curation, for community, for comparison. So you might want to figure out which one of these is right for you. If you're a swimmer, or you're a biker, or you're a runner, you may need different form factors. You can rate them. You can see all the scales. Look at the comparison engine. So even as simple as the wearable elements like a jawbone has different comparisons to a Fitbit, and how do you make sense of those? So would love for you to take a look at that. There's comparison engines. If you try it out now, put in the code Digital Health, you'll get $15 of store credit. And we'd love sort of feedback about how that emerges as a platform to connect, have ratings, and grow this movement in an integrated way.
Cool. So I saw price on there as one of the comparison metrics.
Sure.
And actually, I think this is a really important, right now, these devices, they're getting more widespread. They live in the Apple store. They live in places people go, and people are more used to talking about this now. But they're still kind of priced out of reach of most people. So I would love to hear from you guys, kind of when you're making these products, obviously there's a hard cost, there's R&D, there's a lot that you have to recoup. But how do we actually price these products so more people can afford to use them? Not everyone can afford $150 for a wristband.
Yeah, but this is still new type of devices. But I mean, a year from now, I think we see that in most product categories, that the prices erode over time. And I think that will happen eventually in this category of devices as well, as components become cheaper, as volumes go up. So the price point we see right now is because also that's the value of the products, right? But over time, I think we can see different prices coming out for different products.
Yeah, and I think there'll be two trends. Generally, the prices will come down, but I think over time also there'll be more features added to it. So we are starting from monitoring motion primarily, but we add heart rate, for example, and we're working on a NASA-sponsored research on looking at other parameters such as some measurement of stress, for example. And as the technology progresses, I kind of see that we get more kind of physiologically relevant information that's monitored by the devices.
So that brings us to probably the most important thing that I think these devices are still kind of missing, especially from my experience. I mean, I tried like 80 different devices and apps and things, and at the end of it, I had this great big spreadsheet, and I took it to my doctor, and I said, look what I did. Isn't this great? And he's like, yeah, great. What am I supposed to do with that, right? So, like beautiful visuals on the video that you showed, a lot of I've used most of the things that I saw in yours. How are we actually going to get from a place where these devices, live on our bodies, but they don't really tell us anything when we need to know it?
Well, we all want to move to proactive healthcare. It's the theme of this meeting, I think, and continuous data can predictive. We want to move to an era of predictive and continuous and proactive healthcare. And as a physician, again, if I'm getting every EKG and hiccup that you might have, I'm going to be overwhelmed. So we need the filters in place, not just for the individual, so you get sorted out the right information, but as a clinician, I want to get that ping of the 5 patients in my clinic whose hypertension's out of control that need to come in. And we know behavior change is hard both for clinicians and patients. I think another element of this, it needs to integrate with design thinking. We have Myers-Briggs tests for our personality. What if we had a Myers-Briggs for behavior change? So I know that your app and your UI needs to be different than mine, and the way you display it and make that meaningful.
It may even get to the point where the hardware and the measurement is really commoditized, and the analysis is the killer feature, and the defensibility of these different companies. Whoever has the best algorithm, who can catch something the earliest based on the same set of data or parameters. Maybe
Is that
that
something
will
you
be.
guys are going to work on?
Maybe.
Yeah?
Yeah.
Can you talk about anything past Soylent, actually?
I would just say that the idea of Soylent is to abstract away the details of a lot of the complexity of food, and then with health and body, we would like to do largely the same thing, and using some of the, I think, will eventually become industry standard hardware and measurement devices. Closing that loop basically with your consumption and your behavior is something we would like to offer. Basically, people come in all shapes of sizes and all these different parameters, and having more personalization and more passive monitoring is something that is going to need to happen.
As device makers, how do you guys look at kind of making sense of this data and what Daniel said, which I think is really important, which is like these don't need to just be reactive, they actually need to be predictive and start learning things about you. So
I think one good example, we're working with NASA on a research program, and I think a good example of proactive, kind of preventive procedure is what NASA's doing with the crew, or they're looking to do with the crew. And the crew is obviously very healthy people, but you put them in an environment, let's say for the Mars program, where they have to be in a very confined space, 6 people, things could get crazy. And to prevent that, they want to monitor each of the crew. For example, they have the science of being able to monitor the levels of activity and sleep, the sleep patterns. And one thing they can do is if someone is kind of going down the path where the sleep pattern is very poor, they're very sedentary, then the flight surgeons can come back and say, hey, you really got to get your sleep schedule back in track. So I think something like that is actually applicable here as well. So if we have big data, we're able to kind of collect data over longitudinal periods, then we ought to be able to kind of detect kind of trends that's going to take you to a place that's not so good. And an algorithm might perhaps say, it looks like if you continued on this trend, your sleep is going to be much worse, and your health is going to be negatively impacted. You should do this type of things.
Especially some of those metrics that can be very hard to measure, like stress.
Yeah,
Something that may be a little more abstract, and a lot of things go into that. You could see that if someone's very stressed, they're going to start making bad decisions, and catching that earlier is obviously better, but that's not a simple blood test as far as I'm concerned. So.
And I think one thing that's really nice about a tracker that's on the same person all the time is that it may be difficult to kind of measure between people, but it's much easier to see deviations from the same person, because you can very quickly establish a baseline which you kind of determine as normal, and you basically look for deviation from the norm to kind of detect something that might be wrong.
And also I think it's very important to put all this data into context. So just showing data to a user might be not enough for him to understand what's going on in his life. So that's one take we try to do. We try to put all the data and everything the user is doing in context.
Yes.
So instead of showing a user took a 3,000 step last Tuesday, the user can go back and perhaps see, because it was raining and I was stuck in a hotel.
Right.
So then this makes much more sense. And also if you can go back and review your week, just to see that you have been spending 15 hours in a car commuting, it will inspire you to go out being active during the weekend.
And this will start to interact with your environment. I was on a panel the other day with Robert Scoble and thinking about the integration of smart homes and all this data. It may know from your mood and your tracking data when you come in the house that you've had a lousy day, it's been raining out, put the right kind of music on, and light the fire. And I think there'll be other elements of that sort of start to blend together.
One problem this may run into, though, is trying to determine what is normal. How can you tell they would have a relatively bad day? Maybe every day is bad. I hope not. But I ran into this problem just sending my blood to different labs. Everyone seemed to have different reference levels, and there seemed to be not that much agreement on a lot of these different things. So even if we can't even agree for now what is the normal range for some of these parameters, what if the ideal range is something completely different? So how do we really determine what is normal when there's so much variation in different people's biologies?
Well, we'll start to be our own controls, and that goes beyond just our biometric, blood-based levels. I mean, mood, for example, can be picked up by your voice on your phone. And if you're, let's say, take an extreme, you're a bipolar patient, if you're manic or you're depressed, your pace of speech is different. If you're getting Parkinson's, your voice will change. Those things can be picked up as well. And when that blends with knowing your genomic predilections, your current microbiome, and the camera on your smartphone and tablet that can pick up your heart rate and your emotions, that's where it really starts to get interesting.
Oh, speak up, guys. So I think there's an elephant in the room that no one's really addressing, but I think we're going to have to start thinking about as these technologies become more mainstream, which is who owns the data, and how do we deal with that, and how do we responsibly, when there are incentives and awards and things, for insurers, like how do these devices start playing in that environment, because it's coming.
Yeah, I think really it's the first time in human history where we are able to get big data from relatively healthy people. I think it's a unprecedented event, and I think there's whole kind of the issues of who owns the data, what is a fair kind of use of the data by the companies who've aggregated them. I think all of that's going to be settled, I guess, within a few years.
I think clearly by default it should be private, but if you look at just the sheer potential of something like Watson being able to churn through all of this data being generated, that would, the upside is so high. Should we even encourage people, or what incentives could be offered in order to get people to share their data? And I liked what Dr. Kraft said about some sort of progressive model where your health insurance premiums may be a little lower if you were doing a lot of proactive healthy behavior, and maybe an additional factor for that can be willingness to share this data for basically the greater good.
Right. We're in the Facebook era. We can now opt in, theoretically, into different realms. We heard about, give me your damn data theme. There's datadonors.org. There's folks out of the Netherlands who are enabling people to opt in, not to share their genomic information, their wearable information. And again, when we start to crowdsource the big data, which is really the small data from our digital exhaust, we're in the early era of being able to do that. But as these exponential curves happen with AI, big data, and sensors, I think it's going to be much more meaningful. And in terms of the question earlier, who starts to pay for this? Now it's sort of out of pocket, $100, $200 for a device. I think in the near future, some of the payers, the progressive ones, will start to say, okay, we'll cover you doing this, and your insurance premium will be lower. And if I prescribe you a blood pressure cuff or a glucometer or an exoskeleton downstream, that will be something that starts to be covered. And one great example of that coming together, actually an early rock health company, Moderator Health. It's not just a sensor or a dashboard, it's often community. We often do things for our soldiers in the trenches. They've taken pre-diabetics who are about to become diabetic, put them in a social construct, give them a connected scale, and can show pretty credibly that taking an old model that was done with people in person, you can change that outcome. And I think that will be paid for by the big insurers.
I think even today, if you go on do a Google search, you may not, even today, when you do a Google search, you may not really be conscious of it, but somewhere someone's collecting all of your interests and all that. And I think there really is a big issue of working out the privacy issue as the devices become much more prevalent.
Yeah, and allowing people to that was a big conversation for a while, was that, there were some device makers and apps for that matter, that weren't letting users actually export their data. So, I think those days, the walled garden days are hopefully behind us, but I think we have a lot of questions left to answer. So I wanted to make sure we had a little bit of time for audience questions, because I know that there probably are some, but I would love to just close out and see predictions. What does the future hold? You want to start?
Okay.
Dr. Kraft?
How does the future hold? The future's coming faster than you think. So I think the future is going to be, again, the blending of these technologies. Again, this idea of the OnStar for the body, multiple. It's no one sensor, it's no one piece of data. It's the integration of that to have your own proactive check engine light if you are trying to avoid an accident, all the way to knowing your your genes and beyond to help track and manage a chronic disease like diabetes or heart failure. And that we're going to get into the norm. The track-a-holism element will be something that's prescribed. And when you're sent home from the hospital after a case and beyond, it's going to be part of the prescription.
I think there will be a gradual ramping up, not really an inflection point. But as time goes on, it'll just become more fashionable. And because it is very useful, people will have much more of a desire and much more of a social visibility and incentive to just maybe monthly checkups and not wearing something that'll measure everything every 15 minutes, but regularly getting a panel of tests and just try to measure everything, prevent everything, and then as time goes on, that will get the time differential will decrease and the precision will increase, and eventually I think that preventative healthcare will be a software problem, as we just have. It's just variables.
Yeah, I could share a little bit about kind of the research that we're doing with NASA, which is it's kind of a blue sky research that's going to come to, I guess, fruition in 3 to 4 years. And some of the stuff that we're working on currently is looking at markers for blood pressure. Is one of them. Being able to measure vasoconstriction that's kind of related to stress.
Can't hear you.
We're looking.
We can't hear you. Sorry.
So we're looking at parameters beyond just motion and heart rate, which is very readily available today. We're looking at being able to measure markers for blood pressure, markers for vasoconstriction, electrodermal activity, perspiration, and building a sensor fusion engine that kind of takes all these disparate information together and makes some sense out of it. For example, one that is really important, I think, is being able to predict stress and fatigue from these various parameters. So maybe 3 years from now, we have this really smart devices that's on your wrist.
I'm more hoping for mass market adoption, so that more and more people track their health and maybe get aware of how they're living their life. I think small improvement can lead to huge effect for everybody. Just knowing how you live your life and make small change.
It's the empowered patient movement. The new drugs, the empowered patient, being the CEO of your own health, all that becomes part of knowing your own information, not just the data, but what it means and how to steer yourself down the path.
Great. I see one question already.
Hi, my name is Sipiwe Baleka. I'm with Fitness Trucking. I have something of a sports background. I use digital health both in my personal life and in my business. I've gotten to the point now where I use time trackers to track how much tracking and quantifying I'm actually doing throughout the day. My question is all the quantifying that I do, and I think that we all do, we don't want to just see the numbers because, oh, it's interesting. We want to move from quantifying to optimizing ourselves. And my question is, what will it take to get to that point where, I track my food, my moods, my sleep, my sports training, business. What will it take to integrate the nutrition with the sports and the performance so that there's some app or device that says, well, you woke up at this time, your resting heart rate was this is what you ate yesterday, you trained, your fatigue level is this, so you should train this amount today, you should study this amount today, you should eat butternut squash. And I want something that integrates all of this. What's the biggest obstacle?
You're scaring me.
I think the biggest obstacle, which is a key factor in your health, is being able to accurately monitor what you're taking in, because the calories expended, I think it's a relatively well-solved problem, but the calories taken in and the quality of the nutrition you're taking in, it's really hard because right now you really have to kind of list that down manually. And that I don't know. Hopefully there's a good solution.
Unless you're taking Soylent, which takes away that whole layer of complexity. So the answer is Soylent.
To solve the problem.
Problem solved.
Yeah.
But no, that's a very good point that, measurement only gets you so far. You have to act on it. And at some point, the software or app or whatever can recommend all at once and tell you what it would take to optimize, but it will always at some point be on the user. And I think we should have that amount of freedom.
Also serendipity kind of takes all the spontaneity out of life to just know.
We have another question.
My name is Marcus Shaw from MK Shaw Consulting in Maryland, and we talk about the analytics and having discrete inputs in terms of collecting the data. Do you all have actual objectives that you're trying to hit, and are those as analytical and discrete as the inputs that we calculate or the inputs that we are collecting?
My simple one is sleep. That's an underrated element of healthcare. It's pretty easy with these devices to tell whether you're deep or light sleep. They're not necessarily picking up your REM cycles. That was Zio that went away. So that's something very discrete that all of us could be paying attention to that can be done now with simple apps and wearables, and that can have a significant health impact.
I think there's a lot to be said for picking your goal and after you meet that, not worrying about it. There's a lot to be said for a sort of standard. For me, I picked standards set by the U.S. military in terms of health. If you can do this number of push-ups, this number of sit-ups, this mile time, and then if I keep my body fat percentage at a certain level, that's enough. And then not really worry about that unless you cross that threshold. So I think that can reduce the amount of stress as to continually optimizing, just picking a point where that's good enough.
Yeah, no, I agree. I guess for me, the less initiated, I'm not really an athlete, but I think the two things I can do readily, I think sleep is really key, and then just raising the level of physical activity, even if it's just walking. Those two, I think that I can control.
Oh, you're welcome. Does anyone else have a question? No.
Okay.
I think we're good.
Well, I think that wraps us up then. We're 2 minutes ahead of time.
Oh my gosh.
I know. Yay for being on time.
Quantified panel.
Quantified panel.